And for learning outcome number 7 of module 7, we will be talking about the factors that will affect the contact and the range of motion of these synovial joints. The articular surfaces of the synovial joints, they're going to contact one another, and this is what's going to determine the type and the possible range of motion. Now, the range of motion is going to refer to the range that is measured in degrees of a circle through which the bones of a joint can be moved. The following factors are going to contribute to keeping the articular surfaces in contact and also affect the range of motion. And these are going to be the structure of the articulating surfaces, the strength and the tension of the joint ligaments, the arrangement and the tension of the muscles, the contact of the soft parts, hormones, and also disuse. Let's talk about each of these in the next following slides. The structure or shape of the articulating bones, they are going to determine how closely they can fit together. The articular surfaces of some bones, they do have a complementary relationship, and this spatial relationship is very obvious at the hip joint, as we can see over here, where the head of the femur will articulate with the acetabulum of the hip bone, and this will do an interlocking fit that allows rotational movement. On the left, we can see the articulation of the shoulder joint between the head of the humerus and the glenoid cavity of the scapula. Next, we have the strength and the tension of a joint ligament. Therefore, the different components of this fibrous capsule, they're going to create a tension only when the joint is in a certain position. These tense ligaments, they not only restrict the range of motion, but they also direct the movement of the articulating bones with respect to one another. For example, in the knee joint, as we can see over here, the anterior cruciate ligament is tense, and the posterior cruciate ligament that we can see back here is going to be loose when the knee is straight, and the reverse will occur when the knee is bent. So they sort of complement each other to give this strength and tension in the joint during the movement. In this example, the muscle tension will reinforce this restraint that's placed on a joint by its ligament, and this will restrict the movement. A good example of the effect of muscle tension on a joint is seen at the hip joint. So when the thigh is fixed with the knee extended, the flexion of the hip joint is going to be restricted by the tension of the hamstring muscles, which are located in the posterior surface of the thigh. So most of us can't raise a straightened leg more than 90-degree angle from the floor. But if you actually bend your knee, so if you flex your knee, the tension on the hamstring muscles is going to diminish, and the thigh can be raised farther, allowing you to raise your thigh to touch your chest, as seen in this image over here. Unless, of course, you have a big abdomen, then it's going to be hard for you to raise your knee to your chest. The contact of soft parts basically means that it's the point where one body surface will contact another, and this may limit the mobility. For example, if you bend your arm at the elbow, as seen on this image, it can move no further once the anterior surface of the forearm will meet with the biceps brachii, which is a muscle on the arm. And the joint may also be restricted by the presence, for example, of adipose tissue. Joint flexibility may also be affected by hormones. For example, the hormone relaxin, which is a hormone that's produced by the placenta and by the ovaries. It will increase the flexibility of the fibrocartilage of the pubic symphysis, and this will loosen the ligaments between the sacrum and the hip bone toward the end of pregnancy. And this is important because these changes will permit the expansion of the pelvic outlet, which will assist in the delivery of the baby. So it will widen the coxal bone or the pelvic girdle, and this will facilitate the delivery of the baby. Movement of a joint may be restricted if a joint has not been used for an extended period of time. For example, if an elbow joint is immobilized by a cast, then the range of motion at this joint may be limited for a time after the cast is removed. And this disuse, which means that you're not really using your elbow joint in this case, may also result in a decreased amount of synovial fluid, which will then diminish the flexibility of the ligaments and the tendons and also cause muscular atrophy, which we talked about already, which is a reduction in the size of the muscle. So it's very important that you move as much as possible, because not moving actually restricts the movement and it makes it even worse as time goes by.